Hello, everyone, and thank you for coming back to the Inspired Mom MDs podcast. My name is Dr. Cindy Van Praag, and today I have a special guest. Her name is Dr. Valentina Serna. She is a physician trained in integrative medicine. She is a mother of three girls and the voice behind the Spanish language podcast Te Para el Alma. Her journey began with years of unexplained allergies and skin conditions that forced her to listen deeply to her own body, her emotions, and eventually to the patients that she now serves. In our conversation today, you'll hear how motherhood reshaped her identity as a doctor and why she's passionate about creating a more human, personalized path to healing. We'll also talk about her podcast and the creative life that she has built as a physician entrepreneur. I can't wait to get started. Welcome, Dr. Serna.
Thank you very much for this invitation. I'm really, really excited. It's the English episode. So,
You are doing fantastic. And we've already been chatting for 5-10 minutes, everybody. And she's fine. She's perfect. Okay. So my first question is, just to get to know you. So you're a physician, you're a mom of three girls, and an entrepreneur. And when you think about all of those identities, what feels most alive for you right now?
mm, yeah, I'm a physician, a mother of three girls, an entrepreneur, a podcaster, and sometimes a writer too.
Ooh, okay.
And, but the thing is that all those things are just roles.
Mm,
I have been working a lot lately to not attach me to those identities
okay.
because I'm just me. And if I decide not to be a physician anymore, I still be me. So my
Yes.
identity is just to be a human being.
Mm, mm.
And I have a lot of roles that I love. Sometimes I identify myself with a little bit more being a mother, and sometimes more being a physician, sometimes more being a coach, and sometimes being a podcaster, but that's not who I am.
That is that is such a great lesson because a lot of times when we say no to something in life, it feels like you're giving away a piece of your identity. But if you're looking at it like, well, I'm just human, then you're not giving away anything. You're just giving away a role.
Yes.
Oh, I love that wisdom.
And
Yeah.
the thing is that when you decide to be a physician, is like your whole identity is just being a physician. And it's
Hmm.
so hard to be conscious of that and let go of that.
Yes, I completely agree. So in my introduction, I did briefly mention some of your health struggles when you were younger. So if you would like, can you quickly describe what was happening at that time and how did that shape your path?
Okay. Yeah. I think that a big part of whom I am today,
Mhm.
because of the struggles in my health that I had in my whole life, because
Yeah.
it really started when I was really young, like perhaps I was 8, 9, perhaps. And it started with a stomach ache. I had like burning, and the diagnosis was gastritis. But the thing was that I would even end up throwing up in the school a lot of
Mm.
times. And the thing is that I didn't understood then, but I understand now that it was connected to my emotional state, to my how my nervous system was in those days. But in that moment, I didn't understood. And those digestive symptoms then like diminished, perhaps vanished. And then it started with tonsillitis, tonsillitis number 1, 2, 3, 10, I don't know how many. And the
Wow.
tonsillitis ended up with abscesses, you know, and I had like countless rounds of antibiotics. It was so bad. Like for me, it was so hard to really find out what was going with me. I already made those questions to me, but it didn't change my life. It was not so hard at the end of time. Like I ended up with the same routine, with the same choices
Mm.
until I had my eczema. I think another word is dermatitis. And but it was really, really severe. Like it was just on my face and all my skin went down. And when people saw me, they said to me that I looked like I was burned.
Wow.
It was really, really bad. And I tried everything medicine could give me, conventional medicine could give me. So I had cortisone topic and also injected. Then I was not just fat, but also I got an infection on my skin because all that cortisone. Now I had dermatitis with an infection. And then it was just so bad. I couldn't leave my home for more than 3 months. And that was it. At that point of my life, everything changed. Like I felt that, okay, I have to do something else, you know? This is not working. This is not enough for me because cortisone, yes, I had some relief for some hours, but then everything came back. So that's when I decided like, okay, I have to let go. I have to cry. I have to yell. And then realize that I had to change my food, my habits, my priorities. And the most what changed was the relationship with myself. And then I think it started my integrative path, you know? Like I was like, I don't know, 23, 24, but I already knew that I had to choose another path. I wanted to serve, but not in that way.
Yeah. So that turning point was when you were at home for 3 months.
Yeah.
And that really shifted you from, I guess, all of these symptoms and the treatments controlling you to you taking control.
I don't like the word control because we don't control anything in our lives,
Okay.
not even our bodies. I
Yeah.
think it started the journey to make contact with myself,
Okay.
with what my body was trying to tell me. It was yelling, in fact, because I
Yeah.
didn't hear. It started at
Yeah.
9, you know, and I had another symptom, another symptom, another symptom until it was so bad that it was screaming, and I had just to pause and really hear.
And that's what led you into more the integrative path, or
For
at least you
sure.
knew you were headed there, right?
Or at that moment, I was not sure.
I hear that.
It was a
Yeah.
feeling, you know?
I do. Yeah. I had a similar feeling when I was early in my career with just
Mm.
straight allopathic anesthesiology,
Uh-huh.
but I had a feeling about the integrative side of things, but I didn't pursue it. The feeling is there and then it grows and grows. So tell us about how that moved you into your line of work now. So you do
Okay,
integrative medicine
so
or what do you do now?
after I finished med school in Colombia, where I live in my country, we have to do a year that is like a social work that we have to
Okay.
go to little towns and do 1 year of social work. Yeah, being the only physician sometimes.
Oh.
And that was so horrible. That was really, really horrible. Like I ended up with um, infections, with panic attacks, anxiety, with a lot of things. And then my mom came one day and she said to me, like, okay, you're almost dead.
Mm.
You have to quit. Uh,
Mm.
and it was also like a turning point. Like I decided like, no, this is definitely not my way. Like I'm sick again. But I needed that so I could work. I could work as a physician in Colombia,
Mhm.
but I couldn't anymore. My body
Mm.
was saying to me, like, you cannot anymore. So I quit. And when I quit, I met my husband. I got pregnant of twins. And
Oh,
then I decided I wanted to do coaching in integrative nutrition coaching.
good.
That was in New York, IAN. And that was it. When I started studying, I felt so identified with what I learned. I felt that this was my path, the start
Mhm.
of my path. And because of that coaching, I started some consults and then I changed my city. I did 1 year of research in psychiatry and then I could earn my permission to work as a physician. So after that, I started my consult as a physician and then as a nutritionist. And then I knew about the fellowship. I knew about
Okay.
the integrative fellowship in Arizona. And that was it. I did it. It was lovely. I loved every day, everything. I was curious. That didn't
Mm.
happen to me before in my pre-med. I really liked everything that I learned. And then I could integrate that into my practice. And after a few years, I also felt that sometimes eating well was not enough or changing habits was not enough. And then I decided to do another facilitation coaching on transpersonal psychology. So now what I do is to guide my patients to integrate the trauma, the emotional wounds into the symptoms, like correlate the
Mhm.
symptoms with our emotional self.
Wow, what a journey. And you had twins along that way too.
I had twins, and then I had another girl here at
Uh-huh.
home in her room. It was really
Oh,
beautiful. I wrote a book about it. It is called Rebirth,
oh, wow.
and it's about the conscious birth. I think it's in English. I'm not sure. Yeah, how to be present when you're pregnant and you're giving birth.
That sounds beautiful. I'm sure you'll give us a link to your book. We can give that to
Yeah,
listeners.
in Spanish,
Yeah, that's okay.
for
Yeah,
sure.
I've read some of your writing, and you've called motherhood a totem, and I'm putting that in quotes,
Yes.
that transformed you from the root. Can you share with us what that means?
Yeah, my none of my kids were planned. Like I got pregnant before I really knew I wanted to be a mother and before I knew what I wanted to do or to be in my life. And I felt that since the pregnancy, they were already my teachers, they were already my mentors. And that has not changed along the pathway of being a parent.
Mhm.
Like they have taught me a lot. They have been always a mirror for me for what I have not healed yet.
Okay.
So they always show me what I need to work on me. And I think we can all share that feeling if we are really conscious, like if we are present. And I think that's not comfortable, but that has made me a much better human being. Challenging, and even if it's really, really hard.
Sometimes it's hard to just to have a mirror on yourself and see
For
what
sure.
what needs
For
to
sure.
change.
For sure. But I
Yeah.
think our generation has something beautiful, and it's
Mm.
sometimes when I make a mistake with them, when sometimes I'm not patient and I yell at them, well, I just say, I'm sorry. I'm really
Mhm.
sorry.
Right. And you mentioned they help you to be present. What practices help you to be present, both when you're with your children, but also when you're working?
Yeah. Some years ago, I say to them always, like when they were yelling, or I don't know, it was like a chaos in my home. I say to them, like, breathe, 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 no? But then I understood that they will mirror me and they wouldn't breathe if I don't breathe.
Mhm.
So I breathe. Sometimes I cannot because I'm a human being. Sometimes when I realize that I'm not in myself, I try to breathe, to make a pause, to breathe. I close my eyes and then perhaps they can appreciate that and they also breathe. We make an
Right.
exercise with the little one that we pick up a flower and we smell the flower.
Mhm.
It's an imaginary flower, We just take it and we smell the flowers, we inhale, and then we exhale. And we pick
Mm.
another flower and we inhale and we exhale.
Ooh.
But also with the breathing comes a thing that I just learned as an adult, and now I'm teaching them now, and is to name the emotion that we are feeling. For us adults, it's we struggle with that, and they as kids, but even more. So sometimes
Yeah.
when I'm good, when I'm calm, I breathe, I pause, and then I try to say to them, okay, you're mad, you're angry. Okay, you're angry because your sister took your bicycle, and it's okay to be angry, but you cannot hit us. So when I name the emotion, I feel better, but she also feels better, Sometimes like the amygdala gets like, whew,
Mhm.
and then everything gets better. Sometimes she still cry, but
Mhm.
she's not in such a chaos in herself. So
Yeah.
naming the emotions has helped me. I have a circle here on the wall with a
Yeah.
lot of emotions that help me to put a name, to name, and
Mhm.
then I do the same thing with them.
Yeah. I'm hearing that your children are a mirror to what you're doing. And so what you've done is first off, breathe. That's your primary goal in helping yourself be present. You're becoming present and you're breathing and you're calming your own amygdala, but you're modeling to your children how to respond to stress and chaos that happens in life. And they're learning how to behave from you. And then they're learning how to name their emotions. How old is your daughter that you're talking about?
4.
Oh, she's little. Okay.
4. So
Yeah.
she doesn't know her emotions yet, cannot identify. So I help her in that. But I
Hmm.
feel that when I help her, I help me.
Yes.
But that thing of modeling sometimes is so hard. When I read about it, when I saw videos about it from kid
Hmm.
psychologists, that
Okay.
was so hard because I felt that sometimes I can not even recognize those emotions in me. How can I do it for my kid?
Yes.
So I felt like so impotent, like I felt like frustrated. But then with patience and with calm and with practice, it's getting a little bit easier to do it.
What would you recommend moms who are listening now do to help name their emotions? What's helped you the most?
For me, it's printing. I have an emotion
Okay.
circle because
Okay.
sometimes we have so many emotions that we don't know even us how to name it. Like I can
Right.
read here like devastated or ashamed or rejected or insecure or terrified, But sometimes we don't know those names in those moments. And sometimes
Mm-hmm.
when I read the circle, then I say, wow, what I feel is depressed or I feel is interested or I'm confused. And then everything's get a little bit uh, gets clarified.
Mm-hmm.
And sometimes it's not just one word. Perhaps your feelings are complex.
Of
So
course.
sometimes I can feel a lot of emotions at the same time. Like I'm scared, but I'm also confused, but I'm also scared. I don't know. It's a mix. But if I name it, I think everything gets calmer.
It sounds like you're stepping out of the emotion and looking back as kind of a third party to name the emotion. It kind of puts you in a different
Yes.
role of observer. And the observer is usually more calm than the person who's experiencing the emotion.
For
Yeah.
sure, for sure.
Yeah.
And I think also with my patients, I teach them this to be curious. And that's what I try to do with my kids, that it's so hard to be
Yeah.
curious with what they are feeling and why they are yelling and why they are anxious and why they are angry. If you are curious, you then understand that perhaps they are feeling threatened. And
Mhm.
then everything makes sense. Like, wow, that's why she's crying so much.
That word curiosity is so valuable. It really keeps us away from making assumptions about what the other person is thinking or feeling or why
Mhm.
they did what they did. And
Yes,
if we approach it with curiosity, then we're not reactive to it. And I guess I'm speaking we, meaning me, I'm not reactive to it. And I learned something about that person
for
that
sure.
my emotions wouldn't have let me learn if I wasn't curious.
For
So
sure.
I love
I
that you're
think it's
touching on that.
easier with our patients to be curious. And I say
Mhm.
compassion is curiosity without judgment. That's
Mhm.
for me,
Mhm.
compassion. And I think
Mhm.
with my patients is really easy to do it. With
Mhm.
my kids is hard. And with myself is really hard.
Yes.
That's it. But if I learn with my kids, perhaps I can relearn how to do it that with myself, have to be curious with myself.
So you have your practice and you also create content. You mentioned you're a writer, you're a podcaster. What really motivated you to step more into entrepreneurship alongside seeing patients?
This is going to sound so sad, and I don't want to sound like a victim, but
Okay.
here the term integrative medicine, it almost doesn't exist. Like in Colombia, there is a lot of alternative medicine, Transformative. So the term integrative medicine is not yet known as in the United States.
Okay.
So I would love to work at a hospital where there is a center of integrative medicine, but that doesn't exist.
Mm.
So I have to work on myself. I think I'm opening a path that it's already made in the United States or in Canada for help, but
Mhm.
here in Latin America and in Colombia, not yet. We are not that yet there.
But you are leading the way. You are a trailblazer, as we call it.
Yeah, it's hard. It's hard because I have every time I have to explain, you know.
True.
And sometimes they associate this kind of medicine with stars or with esoteric things or with rocks, you know. Perhaps it can contain something of those things, but for me, it's not like that.
Right.
Evidence-based medicine, but in a more open perspective, in a way that I can see the human being as a complete self. I don't know how to love to make this integration with mind and body and the context you are living in.
Right. The mind, body, and spirit.
And I
Okay.
think I also follow my gut feelings for sure because I'm connected with my body.
Mm.
But what I do about the circle of emotions, that's not because I invented that. You know,
Yeah.
there is a theory behind that. I know that it works because I have read psychologists, psychotherapists that work on that. You know, my
Right.
great mentor has been Gabor Mate, and almost what I do is what he does. Or I
Well,
hope so. I hope so.
you try to. Yeah, Gabor Mate. Wouldn't it be great if he was listening? What advice would you give to other women in healthcare who are feeling called to do something outside of traditional medicine, who deep down want to be a trailblazer like you? What would you say to them?
I wrote that answer and I wrote to listen to their hearts, to be
Mm.
faithful on what is true to them. And I quote, Gabor Mate says that we become ill when we are not being ourselves. So if we follow this pre-established medical path, what would happen is that they will get frustrated, but even more, they will get ill.
Mm.
I have been there. I think this path is not for everyone. And I think I'm really glad there is conventional medicine and that I can go to a surgeon. I'm really glad about it. And I think there are amazing doctors, you know, conventional mindset. A few days ago, I just took one of my girls to an endocrinologist and it's really conventional. It was a good consult, you know, but I
Mhm.
think that path is not for all. And the thing is that if we are not faithful to ourselves, we will not just get sad or angry with ourselves, so that we will get sick.
And each person is called to a different path, and we all
Sure.
complement each other, of course. We need the surgeon, we need the endocrinologist. Not that they can't bring integrative medicine to their practice, but we need doctors and physicians and caregivers of all types
Yeah.
that speak to us at where we are in that moment.
Mm.
Tell us a little bit about your podcast. What inspired you to start it? What are the topics that you cover?
Okay. My podcast is called Tea for the Soul. In Spanish, it is Té para
Mm.
el Alma. And it was inspired because I have a friend of mine that had breast cancer. And
Mhm.
when she told me her story, I felt that there was so much courage in that story. Also, it was so vulnerable that she told. And I felt that that testimony had to be heard, you know, like so many people will benefit from that testimony that perhaps I could be the channel. And that's it.
Mhm.
And that's how
Mm.
it started. She was my first episode. It was the sacred of healing, the sacred of the disease, something like that, the translation.
Okay.
And what I do in my podcast is to interview people, normal people that had gone through disease, different kinds of disease. It can be cancer, it can be autoimmune disease. I interview a girl without a leg. because of a trauma she had when she was a little girl. And I also interview a friend that had vertigo and a boy that had depression and anxiety. And what I try to do in my podcast is like medicine from another point of view and how the disease can be an opportunity for growth and
Okay.
how you can share resources to other people that had helped you to a healing path.
So listeners with a similar disease can maybe find help from your guests.
Yeah, but the thing is that, for
Yeah.
example, my husband have listened all the episodes,
Mhm.
and he and other friends had said to me that they can relate to the stories even though they had that disease, because at the end, no matter what disease we have or no matter what we are dealing in life, we can always breathe, we can always make a pause, we can always, like take those resources to our lives,
Mhm.
to be present in our bodies, to learn how to listen to our bodies. And I think in all the stories, there is this common point, like this path of pause, this path of breathing, this path of meditation, this path of connectedness. So we can all relate no matter how the story was,
There's a common thread
a common thread.
between your guests. Yeah, that's beautiful.
We are all humans,
True. Now, where can people find you to connect with you? And where can they find your podcast?
My podcast is on Spotify. It's not in English.
Okay.
And also I have a webpage. It's Valentina Serna with an S, valentinasernaH.com.
Oh, okay. Okay. And I'll spell that out in the show notes if you need that. Okay, perfect. Thank you so much for being our guest today. I thank you for sharing your story and for being vulnerable and for sharing some of the tools that you use to be healthy.
Thank you.
And
Thank you. Making a voice for the physicians that want to take another path or want to be conscious of and taking different perspective.
I appreciate that.
Because for
Thank
me,
you
that
so
was
much.
also really a struggle to think that I could be a physician in another way.
Bingo. Exactly it. Yes. You get to be how you want to be. You
That
don't
was
have
so
to
hard.
follow a set path. It is hard. Yeah. And then you combine that with motherhood and it makes life more fun, doesn't it?
Yeah.
You're beautiful children. So,
Thank you very much,
so,
Cindy.
and everybody listening, as always, thank you so much for being here today, for listening. If this episode resonates with you, please share with a friend. Thank you. Thank you so much for tuning in today to the Inspired Mom MDs podcast. If this episode resonates with you, please share it with a friend who might benefit too. And I'd be so grateful if you left a review so other women can find me too. You can also connect with me on LinkedIn and explore free resources at inspiredmommds.com. And just a quick reminder, this podcast is for informational and educational purposes only and isn't a substitute for medical advice or care. I'm a board-certified physician, but this content isn't connected to my clinical practice, and no doctor-patient relationship is formed here. Please always talk to your own health professional about any mental or physical health concerns. And as always, take what helps and leave the rest. See inspiredmommds.com for full disclaimer.